Urology deals with around 20% of different cancers that can occur in humans. That is why our field is extremely important, especially in terms of oncology. In Heidelberg, we can offer everything from basic science to healthcare research and clinical studies that are state-of-the-art, and we are also involved in developing and testing new procedures ourselves. The surgical center in Heidelberg has 18 operating rooms. We have the entire spectrum of surgical equipment at our disposal, from surgical robotics and laparoscopy to open surgery and special instruments. 1 in 10 men will be affected by prostate cancer during their lifetime. This means that it is a common form of cancer. Early detection is of primary importance. At our hospital, we have all the imaging options at our disposal, both in terms of MRI examinations as well as high-resolution ultrasound diagnostics. And when it comes to surgery, we are extremely well equipped to perform these procedures robotically. The robotics program has a very long history in Heidelberg. We are one of the clinics that embraced robotic procedures very early on. These have the advantage that instead of incisions of around 10 centimeters, they only use several small incisions measuring around 1.5 centimeters. On the one hand, this is a cosmetic aspect. At the same time, however, this procedure also means that patients can recover sooner, return to their everyday lives more quickly, and experience less pain or complications with wounds. The decisive factor for us: how is the functionality, the quality of life in the long term? Robotics is an important aspect, especially in oncological procedures, that is, removal of the prostate, kidneys or the bladder. But in recent years, I have discovered the real secret power of robotics, which lies in reconstructive procedures. I particularly enjoy finding solutions to problems that may go unresolved elsewhere. In terms of the type of procedures we perform, we have a strong focus on kidney tumors. We treat around 300 kidney tumor patients per year surgically. We are able to treat the vast majority of them in a way that preserves their kidneys. This means that we remove the tumor from the kidney, but keep the kidney functioning. Heidelberg is a very special, cosmopolitan place. We want to spare our patients who live far away the trouble of traveling here, especially for a consultation. This is why we also offer online consultations. These allow us to discuss the respective cases and treatment options individually, and to then consider specifically whether traveling to Heidelberg makes sense and will help the individual patient. Our nursing staff is of course particularly important for our patients, especially in everyday inpatient care at the clinic, and we have a well-established, very experienced team on our wards. All of us in the team are at least bilingual, and for all languages that we do not cover ourselves, patients can hire interpreters who may also assist with navigating appointments and administrative matters during their hospital visit. Urology is, of course, a field that deals with sensitive parts of the body. And for us, it goes without saying that we provide a protected and private space wherever possible. We have someone who is an expert and specialist in each specific problem. We work extremely closely with our colleagues at the National Center for Tumor Diseases to develop a targeted treatment plan for our patients that evaluates the right systemic treatment both before and after surgery. For all complex oncological cases, we discuss the procedure in a tumor board. This means that we look at the imaging together, discuss the available findings, and often discuss the sequence of measures even before surgical procedures. I think we can develop even better minimally invasive approaches, especially by finding situations, particularly in conjunction with systemic therapy, where we can be less aggressive through specific pre- and perhaps also post-operative treatment. For example, in bladder cancer, we might be able to preserve bladders that we previously had to remove. And in prostate cancer, hormone or drug therapy before and after surgery could potentially allow us to treat even more gently.